You can be healthy at any size. That is so important. I do not try to tell patients you need to lose 100 pounds or you need to lose 20 pounds.
Welcome to Healthier Me, a show that highlights the health journey of everyday individuals in Saginaw who have chosen to take the steps to be well. I'm Alexandria Renee, and today Dr. Dafina Allen joins me. She is a board-certified family medicine and obesity physician. She joins us right here on the Healthier Me show. Dr. Allen is the founder and CEO of Wise Weight Management Medical Weight Loss Clinic. Growing up in a family that emphasized healthy eating and physical activity, Dr. Allen developed a deep passion for prevention, which sparked her interest in weight loss. She observed that many of her patients had medical conditions related to obesity, but lacked the necessary tools to lose weight. Dr. Allen joins us today to share how she's empowering not only her patients, but our Saginaw community. Thank you so much for joining.
Thank you for having me.
Yes. So how are you today?
I'm doing really well. The snow is melting, so I'm pretty happy.
Same. I know. I was driving in and I'm like, oh, the sun finally came
Just
out.
a little pop of it. I'll take it.
So first off, I just want to say kudos because, as I said, I remember hearing you speak at the Obesity Summit, and I kept thinking, like, I wish so many other people could have heard the conversations that was happening in the room because we're in a crisis. Saginaw County is in a crisis, and I just want you to talk about that a little bit more. We're seeing these high numbers of obesity in our community. So chat with me about that. Talk to me about it.
Yes. So obesity is a chronic disease, and even the American Medical Association is now recognizing obesity as a chronic disease. So in the past, we used to think about obesity, calling someone overweight or, negative connotations. We're talking completely about health. And we know that obesity significantly increases the risk of heart disease and strokes, type 2 diabetes, obstructive sleep apnea, depression, osteoarthritis. There's just so many different medical conditions. And that's why we want to do something to help the community to really improve the rates of obesity, because in Saginaw County, it is a very big problem.
It is. I think I read somewhere that we're almost like in the top 10% within the state of being high in obesity rates.
Yes, absolutely.
And it's happening. I mean, we haven't seen these trends. It's been 20, 30 years, and now we're seeing this high rate. So what changed? What happened? Why are we seeing such high rates of obesity?
So we call it multifactorial. We're thinking about all these different factors that have contributed. So one, there's a lot more screens, right? And in the inner city community, as well as in outside areas, a lot of times we have even more emphasis on screens, right? More video games, if parents aren't home, more time spent on computers, less time outside because we're in cold weather. So that is one major factor. And then also there's less gym. Like even in the Saginaw community schools, they have gym maybe once a week. In high school, you don't even have to select gym, so you don't have to be active at school. And so that's the part about activity. And that's also a problem in communities because there's not enough gyms, there's not enough access to fitness. When it gets cold outside, there's not enough access. So that's the movement problem. And then there's the problem where there's increased stress. So we're not getting enough sleep. We have increased stress, increased rates of depression, and increased mental health challenges, which also contributes to obesity. And then the last major factor also is the eating. There's more convenient foods, there's less grocery stores, there's less fresh foods available, and there's less education about how to prepare food in a quick, healthy way for people's families, so they will turn to foods that are not as healthy, and it just perpetuates the problem.
You've said so much. I'm thinking about screens. I was having a conversation with my daughter recently. So she's 11. And she was like, high schools, I don't see a playground there. And I was like, you're right. Like, I never thought about it. But no, there's no playgrounds. There's what happens after elementary and middle school? Like you said, kids are not being active.
Right.
And so I want to ask you, a part of your health clinic, do you work with teens or children as well?
I do. Yep,
Okay.
absolutely. And I have two roles within well, I have multiple roles in Saginaw, but so I own my practice, Wise Weight Management, and I also work at Great Lakes Bay Health Center. And in 2024, I helped to start up a weight management clinic for Great Lakes Bay Health Center patients with obesity. So that's been huge. So I get to do
Wow.
two hats, which is a lot, but also really awesome because I get to work with different people in different ways. So in both of my practices, I do see teens, and
Mm,
I actually have a significant amount of teens at Great Lakes Bay Health Centers trying to help patients with more activity, even with their busy schedules.
mhm.
And I actually see on in both of my practices as young as age 2, because really obesity can start very, very young. And at that age, it's really about empowering families and helping
Yeah.
them to change some of their behaviors together, because we're not trying to help kids lose weight as much as we're trying to help them lower their risk of medical conditions and help them with more healthy ways to enjoy the way their body is growing.
Mm. So you said you work with children that's as young as 2 years old.
Absolutely,
How does
yes.
that even look? Like,
Right.
paint the
I
picture for
know.
me.
So with children, ages 2 and up is when we start to look at the BMI.
Mm,
And so for kids, we don't look as much as the BMI, where a BMI would be 33 or 28. We look at it more in percentages.
okay.
So pediatric obesity is when your BMI is at the 95th percentile compared to other kids your age. So for those
Mm.
kids, we're seeing higher rates of diabetes, higher rates of high cholesterol at younger and younger ages.
How? I'm
Yeah, and
I'm I'm so confused. Like, what are they being? Is it something that they're being fed?
the food
Okay.
absolutely contributes for sure, because it's a lot more processed foods than there were in the past. And
Mhm.
then also because of the higher rates of obesity, we're seeing younger kids that are weighing more, then that is contributing to them developing diabetes and other medical conditions at a younger age.
Mm,
So if I do see a 2-year-old, the most important thing is I'm not trying to help them lose weight,
mhm.
right? But I'm trying to make sure I find out who in the family is in charge of their meals and what their day is looking like.
Mm.
And I mean, even babies, sometimes are overfed formula, right? Or they're
Yeah.
overfed, and that just perpetuates the problem. So we really work together on like what type of foods they're eating and what they can put into their diet that's healthy, that's not going to be expensive either.
That is so interesting. I'm
Yeah.
I'm so much is coming to my head just with this conversation. So when you're working with a family member or a caregiver on how to feed a child, what could you give us an example of like a treatment plan? Like what would that look like for
Yes,
them?
yeah. So we have them. So one thing that's really important with children is there's a lot of data that shows they need intensive lifestyle counseling.
Mm,
So for kids, we have to make sure the parents understand we need multiple visits. We're going to
okay.
try to check in at least once a month. And honestly, sometimes it might just be a phone call to the parent if the parent can't get to our clinic every single month.
Okay.
Because, of course, especially for kids under the age of 10, it's going to be a lot more of what the
Mhm.
parent is saying. Although, of course, as kids get older, we want them to have choices and make decisions in this too. So, really, in a visit, we're going to go over a food diary. And it might not be every single day, might be even 3, 4 days a week, just a
Mhm.
food diary, and say, hey, what did they have for breakfast? Tell me what they had for lunch. Tell me
Yeah.
about their dinner and their snack. That right there in itself is so
Yeah.
eye-opening. We might just start off by saying, this 3-year-old shouldn't be drinking pop, and just helping them with
Yeah.
other liquids that the child can drink. That can be a huge starting place. It might be that, oh, are there a lot of chips being brought into the home?
Mhm.
Because if there's food brought into the home, then we know that we're going to eat it, right?
Yep.
So we work on that, and then we'll talk to them about their movement. I mean, if they are 5 years old, the parent can go on YouTube with them and they can find dancing they can do. There's so much fun exercise that's
Yeah.
free. And then I talk to them about like community resources. There's lower cost options at the YMCA.
Mhm.
There's different options. There's this center courts. Kids and adults can walk for free. And there's other activities as well that we want to encourage. So we'll give them a plan, say, hey, let's have this child go with you on a walk 3 times a week just to get their body moving more.
Yeah.
And then we talk to them about how much they're sleeping. So we're trying to make sure they're getting an adequate amount of sleep for someone their age,
Yeah.
because that also plays a really large role in their exercise and their eating choices, and make sure they're not developing sleeping disorders, which can go along with obesity as well.
There's a lot.
It is a lot. Yeah, it is a lot. It's
It's a
very
lot.
personalized.
Yes.
Hmm.
So how long would someone be in a plan like that when
Good
they're working at your
question.
clinic or at the Great Lakes Bay Health Center?
Yeah, it really varies. The big thing I would say is that if there is significant obesity, it's going to be at least a year.
Mm,
So I really encourage at least 6 months of intensive lifestyle counseling.
okay.
And anti-obesity medication options are available for adolescents now. And sometimes there's even off-label treating of obesity with medications in addition to their eating, their movement, their sleep, and stress management too.
Okay, so you brought up the medication.
Hmm.
And I have been quite fascinated with this whole conversation. Of course, we're seeing it on social media. We see celebrities taking these injectable drugs that I thought were meant for people who had may have had diabetes,
Right,
but they're using it more so for weight loss.
right.
Is it safe?
Good question. So, for the right patient, absolutely.
Okay.
These are amazing medications, and actually, we call them game changers in the field of
Mm,
obesity medicine, because with the right patient, if the patient is tolerating them, certain medications can cause, 20% weight loss long term. But there's some really key important parts about these medications. One, they are for long term. So I explain that to all of my patients. We're not going to put you on this medication and stop it. Now, of course, if someone gets pregnant, if someone's not tolerating the medication or develops some sort of side
mhm.
effect, yes, of course, we're stopping it. But otherwise, if you stop it, you're going to gain the weight back. Similar to blood pressure medicine or high cholesterol, if a person stops those medicines, we expect that they would have that problem again. That's the same thing with weight loss medication. It is for long term.
Oh, wow.
Yeah, it doesn't
Okay.
necessarily mean the rest of the person's life, but it's most patients are going to be on them long term. So it's first things first. The first
Hmm.
important part is educating on that.
Wow.
So
Okay.
another key part of those medications are they're not new. So they were developed, they were used for
Hmm.
diabetes for years now, but we have been seeing diabetics lose weight with these medications for a very long time.
How did it become so popular then?
Yeah. So really the bigger factor is that it's kind of like similar to ADHD medication. You don't have to have the diagnosis of ADHD to see that, oh, this medication helps me focus. And so that's
Gotcha.
how there can be inappropriate use, right? And
Gotcha.
so it kind of became one of those things where first because we've been prescribing medications off label. When I say we, physicians for
Okay.
many years, we use a medication that helps migraines, also will help treat a seizure, or a medication for blood pressure that also helps someone sleep. So
Mm,
we can safely do this with our experience. So
yeah.
a lot of diabetics, we were starting to use them more to help diabetics lose weight as well as to help lower their blood sugar.
Gotcha.
Then there was more trials being done, more trials to say, hey, these people with type 2 diabetes are also getting significant weight loss. They're also, more full. And so then they started doing more trials, more long-term data was coming out. They were, trialing these medications for 5 years, 10 years to see the
Okay.
long-term effects of them. And they're showing that these patients can lose weight and keep it off when they're using these medications
Mm,
with lifestyle changes, right? So
right.
with appropriate sleep, eating right, stress management, and exercise. So,
So I guess in my mind, you're saying that it's a long-term medication.
mhm.
So I can't get off of it and continue the other habits and keep my weight off.
Right, no. And it's a really common misconception.
Mm,
Now, there is data, and as well as my experience, a lot of patients with obesity that do take these GLP-1 injectable medications can lose anywhere from 10 to 20% of their weight.
mm,
So now, let's say we did stop a patient's medication that they were taking. They might, we can expect they're going to gain most of that weight back, just because of the fact that it's working on a fullness hormone. And so, if we take the medication away, then our appetite is significantly stimulated again. People are going
Gotcha.
to overeat. It's very, very common. So,
Mm,
but the other thing about the medication is some patients I won't use as high of a dose if someone's expressing that they don't want to be on it long term, and I talk to them about expectations. If someone's, the goal is to help them lower their health risk, not just to be a certain number for their weight. So I'm really focusing on the health part of weight loss instead of the aesthetics. And I
yeah.
tell patients there's nothing wrong. We all want to look a certain way,
Yeah.
but this is an epidemic. This is really about health. And really, looking a certain way is not going to keep you motivated for your weight loss plan anyway.
So it sounds like you kind of do like this holistic type of treatment for your patients.
Definitely,
Okay.
100%. I have some patients that come to me that said, I will not take an anti obesity medication. I'm not comfortable. I don't want to. And I said, that's fine. No problem.
Mm.
Those patients will need more intensive lifestyle counseling and it will take longer. They might not lose as much weight, but it's not about how much weight is lost.
Yeah.
It's about how someone's sleeping and how they're moving and also how they see themselves. So the other thing is, I do explain to patients we can use anti obesity medication. It can be a really
Mm.
important missing piece of a weight management plan. However, if we ignore lifestyle and we ignore the fact that you're emotionally eating, we ignore the fact that you're eating unhealthy foods on a daily basis and not sleeping, not moving, the weight loss medication, people will still gain the weight back.
Wow.
So it might come back slower, but it's really about changing the lifestyle, and
Yeah.
that definitely takes time.
So I have to ask, are patients going to see like therapy outside of talking to you? Because I know you're talking about emotional eating. To me, that sounds like mental or behavioral issues.
That's a really good question. So, I do have some therapists that I work with that actually are specialized in helping patients that do have challenges with binge eating or overeating,
Okay.
people that have challenges with stress eating. I've also been trained to give patients tools to help with their stress and emotional eating. It depends on like how severe it is. But the biggest thing about emotional eating is there's a lot of undiagnosed mental health disorders. I actually, at my practice for weight loss, I meet a lot of patients and then diagnose them with depression.
Mm.
And then I say, okay, it is so important. I can get you started with some tools. You have to go back see your primary doctor or see psychiatry, see a therapist for us to
Mm.
help put you on a weight loss plan. Because if you are struggling with poorly controlled anxiety or untreated depression or unresolved grief, any of those things, trauma, we can do all the other right things, but you're not going to lose weight and you won't keep it off. And
Mm.
sometimes that will motivate a patient to take better care of their mental health. I have a lot of patients that come in and say, oh, I'm only depressed because of my weight gain. And they think that, but the more we explore, and then I'll help patients to lose 50 pounds, they're still depressed. So
Mm.
the way we see ourselves and our body image definitely does play a large role, but really treating the undiagnosed or unresolved mental health challenges is a huge, huge missing piece when it comes to treating patients for obesity.
And it's no, it's not funny you said that, but I'm thinking about that because it was one of the questions that I had with the injectable drugs. Are we only attacking the symptom? Are we really getting down to the root cause? But it sounds like you are by encouraging them to go to their primary care physician and speaking to a psychiatrist or a behavioral therapist or someone like that.
Definitely. And
Okay.
so anti-obesity medications, so the GLP-1 injectable medications are the ones that are most popular. And it's funny, I was at a conference and one of the speakers was like, they're the notorious, but they're also the sexy drugs, right? Because you can't go anywhere without seeing information about them.
Hmm.
There's other anti-obesity medications that have been on the market even longer that I use. I also use other medications as well, maybe patients with overeating. I might also prescribe, and depression, I might prescribe them a
Hmm.
medication for their depression that also helps with their appetite. So there's other ways to treat obesity other than just the injectable medications.
Gotcha.
And the big factor is everyone doesn't tolerate them and everyone doesn't have access to the injectable ones. And that's fine. I always tell patients, I have people they lose insurance coverage. I have people
Mm.
that they were taking it and something happened, they had a bad side effect and I said, "That's okay. It's not the right medication for you. They're not right for everyone."
Okay.
So, and that's okay. I always tell patients, I've been doing this before those medications came out. the medications are great and there's going to be more
Hmm.
options, which will be less abuse when there's more options and more indications for these medications. But I also let patients know they're just not for everyone. And
Yeah.
that's some people don't lose weight with the injectable medications. And I've worked with patients where they did experience that as well. Most will, but some don't. And
So
so,
what are their options? Is it on
yeah,
to like surgery or anything like that?
good question. So same thing. Some of those patients might respond to a different
Hmm.
anti-obesity medication. Some of
Okay.
those patients it might just be because they did not address their emotional eating. And so you got to get much deeper into that. And bariatric surgery can also be a great fit on top of a medical weight management plan.
Mm.
So, yes, for those patients that do have significant obesity, bariatric surgery can be a really great fit because it really changes some of those hormones that control our hunger and our fullness. But some patients decide to take that route even when they are on medication,
Hmm.
and some decide not to. But I'm very supportive of it. Any surgery does have risk of
Hmm.
complications. The risk of complications from obesity is actually higher. And actually, I work really closely with the bariatric surgeons in our area, and they really are also
Yeah.
contributing to improving the health of our community.
That sounds amazing. We had a few people on the show who've had bariatric surgery, and I think one of them mentioned that they felt like they were cheating if they
Hmm.
had got surgery. So what are your thoughts on that?
Yes, I hear so many people that are like, "Oh, well, if nothing else works, then I'll get surgery." And I'm like, "No, it can be another
Mm.
piece of a treatment plan." Same thing, medications. I even talk to physicians that say, "Oh, that they're just a crutch. People just need to put the fork down." And
Mhm.
it's a myth and it's outdated. Putting the fork down and just eating less and moving more is a short-term solution that is ineffective. There's so much more to
Mm.
obesity. And so bariatric surgery is not a crutch. Anti-obesity medication is not a crutch, but they can be if a patient is not given the tools to
Yeah.
still improve their health and their lifestyle. Because with bariatric surgery, patients can regain the weight also if
Yeah, I've
they
seen
don't,
that.
yeah, if
Yeah.
they don't get the proper tools with how to stop overeating
Mhm.
or how to increase their protein, how to get proper sleep, undiagnosed mental health challenges, all of those things can cause weight regain.
So it sounds like, because I know at your clinic it's you and your husband.
Mhm.
He's the sleep doctor,
Yeah.
but it sounds like you need to get a full house of these other people in there.
Right. Well,
That's what it sounds
you
like.
I definitely do not do it alone. I mean,
Yeah,
there's
it's a
some
lot.
really great people in the area that I refer to. Like I said, I have a couple therapists that I will
Mhm.
send patients to. I also have a dietitian that I send patients to for wise weight management. And then I also have dietitians that I work with at Great Lakes Bay Health Centers.
Wow.
I refer patients to my husband all the time
Mhm.
because there's so much obesity hypoventilation syndrome and so much
What
obstructive
is
sleep
that?
apnea.
The
It's
hyper.
another medical condition
Okay.
that can be related to not getting appropriate breathing and ventilation with obesity. So
Mhm.
that and obstructive sleep apnea, which is much more commonly heard of,
Yeah.
is so prevalent with obesity. So I refer to him all the time. I also will have patients go see trainers and work with them on a specialized program. I have some videos that a trainer put together for me to help my patients, just even if they're not able to get
Wow.
outside. So, and I, love being a part of Be Well and their community group because it's a lot of different people that I learn from, and we all work together in different ways to improve the health of the community.
Yes, you're doing amazing work. And I
Thank
have to
you.
ask you, how did you even get into this? How
Good
did you become
question.
an obesity specialist?
Yeah,
Or
great question. So, as a little bit was mentioned in my bio, I come from a family that was really passionate about, we all played a lot of sports.
Mm.
And my parents were really passionate about healthy eating. And it was just something that I always loved. I loved learning about science. I loved learning about nutrition. And so in undergrad, I got my degree in nutrition.
Mhm.
And that was just fascinating. It was so cool to learn about how our body can fuel us in the right way.
Yeah.
And so then I thought, I want to help people stay healthy. That was one of the big things as to why I went into medicine. And so I chose family medicine because it's definitely all about
Mm.
prevention and you get to work with families. So within family medicine, I did quickly burn out just seeing lots and lots of patients, having to
Mm.
see lots of patients. And then I had a lot of patients that kept asking me, how do I lose weight? I'm trying, I'm tracking my calories, or I started walking outside, but I'm not losing weight.
Mm,
And I was seeing them for their blood pressure and their cholesterol, and I was giving them medication, but I wanted to do more. And I'm a big proponent of patients taking medications that are prescribed, but also the tools on top of them
yep.
that matter the most. And so within family medicine, I started doing a lot more research. And with my patients in my primary care practice, I started like writing out little health plans about like, hey, all right, add on this much exercise and, track your food. And I
Mm,
started giving them handouts about eating tips. And then I found the Obesity Medicine Association, which is a national organization of physicians
mhm.
as well as APPs, so nurse practitioners and
Yeah.
PAs that are passionate about treating obesity. And I found out it was an actual specialty. And I was like, oh my gosh, like I love helping patients lose weight. I love prevention. This is something I want to learn a lot more about. And so then I went to a conference and I just never looked back.
So how long has that been? How long have you been
Yeah.
in this practice?
So, Wise Weight Management, I started in 2021.
Okay.
So before that, I had started up an obesity practice within my primary care practice. So I got certified by the Board of Obesity Medicine in 2019.
Mhm.
So I started really learning a lot more about it in 2018, and then 2019 I got my board certification, and then 2021 is when I started doing weight management almost full time. So like
Mm,
almost the majority of the medicine that I practice now is obesity medicine.
that is great. And you brought up those dates and it made me think about the pandemic because we saw a
Yes.
lot of people getting back outdoors in
Mhm.
2020. I think at least that's what they said. You know, they're getting out, they're starting to walk, but then now they're back to work and we're back to that same condition of processed food. We're sitting at our desk, we're at home on the couch watching the screens like you said.
Yes, and there was a lot of unfortunate parts with the pandemic. I mean, COVID-19 and patients with obesity were significantly affected with
Mm,
more complications. And it's interesting you said that about more patients getting outside because some patients were working from home, some had
yeah,
lost their jobs temporarily. There were also people that just got so sedentary. They
that's
just were
true.
inside watching the news. They were working from home, so they were not even getting up and walking around the office anymore.
Mm,
And a lot of patients that the processed food significantly increased for stress relief, and that mental
mm,
health challenge
that's true.
worsened as well. And so that was another push for me to learn more about treating obesity, to learn more about improving the health of patients. And it doesn't just have to be obesity, right? It can be anybody that wants to improve their eating and their
Hmm.
movement and their overall lifestyle.
Yeah. This is great. I'm really enjoying this conversation.
Me too. I could talk about this for years. So
I can, and I just hear the passion just kind of like oozing out of you as we're talking. You talked about the injectables. I do want to touch base with your clinic. And like I said, we brought up the sleep doctor, your husband.
Mhm.
So talk a little bit more about that relationship and why it's important to pair good sleep manners or behaviors with weight management.
Good question. So it is the more and more I learn about treating obesity, the more and more I learn about the importance of sleep. And it's really funny because I'm a person that's really into fitness. And I used to get up and go to like a 5 a.m. workout class a few times a week, which occasionally I'll pop in now. But I remember my doctor years back was like, you know what? It actually might be better for you to sleep a little longer than to go to the exercise class. And I was like,
Mm.
what? No way. But I mean, now maybe I could have got in bed earlier, right?
Mm,
But actually, when patients don't get enough sleep, patients are more, people are more irritable. People
that's
are
true.
also hungrier.
Yeah.
It increases that hunger hormone. It increases our cortisol stress hormone, which increases the amount of fat around our stomach. So
Mm,
actually, a lot of patients that are very sleep deprived, I don't put them on an exercise plan. We talk about maximizing their sleep first, and of course, some patients can't sleep as much because of untreated mental health conditions,
mhm.
as well as just their lifestyle. Maybe they have to work two jobs. Then we talk about being intentional about the sleep time that they are allowed, even if they can't get the 7 to 9 hours. But the really cool thing about working with my husband is there's so much back and forth where he refers patients to me all the time.
Mm,
So many patients with sleep apnea that they are getting used to wearing their CPAP. And he's like, another thing that would really help treat your sleep apnea is weight loss. And so it's recommended even losing up to 20% of your weight can significantly improve sleep apnea. So then he'll send patients to me. And then for
That's awesome.
me, it's so great because I'm seeing patients and then I'm finding out they're snoring. They have super interrupted sleep. They have very poor delayed sleep, or they are just having insomnia. So then I'm able to refer to him so he can take care of that. And it's a really nice partnership because really, I mean, you cannot ignore sleep. You will
Mhm.
lose weight temporarily, but long term, the weight comes back when there's not healthy sleep. hmm
Yes.
It's
And
a
that's when
really
your
key
body
missing piece.
rest and recover during that time. And we don't
One
think about that.
100%
Yeah.
right. You're so right.
Mhm.
Recovery actually is super key when it comes to even for a weight loss plan. We need stress reduction.
Mhm.
Our stress levels are higher when we're sleep deprived. So it's one of those things where we have to address it if we want to get that long term success. And I always tell patients reach for the easier parts. Going to bed earlier, yeah, it might be harder at first, but it's easier to make healthy choices. And we all want to find ways that it's easier to make healthy choices.
Mhm. So when someone is thinking about coming to your medical clinic or even working with the Great Lakes Bay Health Centers, is this a part of their insurance plan? How can they find you or be a part of your services?
Great
Get your
question.
services?
Yes. So if you're already a Great Lakes Bay Health Center patient, you can see any provider within Great Lakes Bay Health Center. And if you do have obesity, then your provider can be referred to our weight management clinic. So that's one option. And I do have a nurse practitioner that works there with me as well. So for Wise Weight Management, we are a concierge practice. And so what that means is we charge a monthly membership. So we don't bill insurance because I'm a family medicine doctor that's also practicing obesity medicine. It just gets a little bit complicated when we collect insurance for my Wise Weight Management practice. However, patients can submit their insurance, their bills to their insurance for some reimbursement if they see me at Wise Weight Management. And we have lots of different pricing options as well because we
Mm.
do meal plans there. We also have people that maybe they don't do a membership, they might just come in for a consultation. And so we do a free Zoom twice a month where I'll talk more about the program and the different options. So that's really great. And then also at Wise Weight Management, we did get a small amount of funding where I do also have a small panel there where I'm able to give some free medical advice and also some free help. They can also use our body composition scale for free. And I
Mm.
call them to check in with some funding that I received from the Saginaw community, which was awesome.
Oh, that's
Yeah, so there's
awesome.
two different ways.
Yeah.
And through Wise Weight Management, wiseweightmd.com is my website. And it's very easy to be able to get in touch with our practice there.
Oh, I love that. And so when I think about when you talked about like inner city kids or people who are looking at the screens and things like that, wh- I don't I don't know if the question would be to ask you, what does your patients look like, but are we really tackling those inner city issues or are we looking at people who are on a different class scale? You know
Really
what I
good
mean?
question. Yes. I'm so passionate about treating all patients, right?
Okay.
So I think really I see a lot of inner city patients
Mm,
and it's about meeting people where they're at.
okay.
Because even so in the inner city, there's a lot of trauma. So if we ignore that, and there's a lot of adverse childhood events that have happened. So if we ignore that and just tell someone to go eat healthy, we're missing the mark.
Mhm.
And so really, I really focus on that for children as well as adults that maybe come from an underserved area. And so when it comes to screens, honestly, I think we're just seeing that everywhere across the board, every socioeconomic status. Although in the community, in the inner city community, there can be less options. But we really work with patients where they're at. I have a lot of patients that, maybe they can't afford to go to the gym. And some patients, they will work out outside until it gets cold. Then
Mhm.
they might just pay $10 a month to do Planet Fitness just for a couple months out when it's really cold. And I also have resistance bands that I'll give patients that they can do resistance training at home with exercises.
Yeah.
So that can be done. There's free YouTube and TikTok. But the big thing about that, I'll give patients the instructors to look up. So don't
Okay.
just say go on YouTube because there's like millions of information out there. But I'll give them look up these instructors, look up some beginner videos.
Mhm.
Because when it comes to less screen time and more movement, you really want people to do what they enjoy. That's something that's important. And when it comes to less screen time, for stress management, I really help patients with choosing other stress relieving activities. There's nothing wrong
Like
with
what?
so I have a list actually. I think it's up
Okay.
to like 35 different activities. So it could be coloring. It could
Mm,
be journaling. It could be shopping in your own closet. So I like to give people low cost, no screen or food involved. It could be
mm,
talking with the clergy member at your church. It could be texting a friend. It could be taking a quick walk. It could be having a good cry because that's what you need. It could be painting. It could be writing a poem. There's so much. The benefits of journaling your food, or even just your emotions are
I
huge.
do that every day.
Yeah, that's awesome. That is
It
so
does help
great.
a lot.
It's so great for mental health. It's really great for emotional eating. So I tell patients there's nothing wrong with watching Netflix. If you're stressed out, you watch Netflix, that's fine, but it cannot be the only thing you
Mm,
reach for because we do know that screens can increase unhealthy snacking as well. Like I mean, when you're on a screen, our brain will start to want to just kind of be more sedentary
mm.
and reach for unhealthy food. So that's why it's good to have other things to choose from.
Yeah, that's so amazing. I'm loving everything that you're talking about
Thank
today.
you.
I want to ask you, given everything that you've learned from schooling as a doctor, having your own practice, what is one thing you want people to know and understand about weight management?
So that they're
I know it's a
absolutely
lot, but
no,
what is
no,
the
no, that's
one
okay.
thing?
I love that question. You can be healthy at any size.
Mm,
That is so important. I do not try to tell patients you need to lose 100 pounds or you need to lose 20 pounds. We really help patients find their best weight. And so I really want the community to know that you can be healthy at any size. You can love you the way you look and still improve your health with a healthy weight management plan. And that might take time, but it's absolutely possible.
I love that. You can be healthy at any size. I want to share. It was a guest that we had who was in the military, and so he would step on the scale, and of course they would tell him that he was overweight, but then they would tape him and was like, "Oh, your BMI is actually lower." So you can be healthy at a different size. Even when you step on that scale, maybe the numbers are high, but when you're during your measurements, you might have a lower BMI. Is that
Absolutely.
correct?
Yes, BMI is just a screening tool. I
Okay.
love helping patients understand that really we don't want them to just have a lower BMI.
Mm,
We want to help them lose body fat. We want to help them improve on their muscle mass. So I love using
gotcha.
a specialized scale that measures their body fat. We measure their waist circumference and we measure their
Mm,
muscle mass, their water weight. It's so much more rewarding and we measure their inches to be able to see that that's the healthy weight loss that people are looking for.
got you. And you said you have that machine actually at your clinic,
Yep,
that
at Wise
particular.
Weight Management. Yep, it's a body composition scale. Anyone
Okay.
can use it. You do not have to be a patient at Wise Weight Management. And it's so great. I just had a patient. She was frustrated. She had only lost 10 pounds in 4 months, which I thought was awesome. But still, she had a much bigger goal than that. But she came in, she had lost 4% body fat. So,
Wow.
big reason she had not lost as much. She had also been doing strength training. She had gained muscle mass. She had lost 2 inches. And so that gave her a much better understanding of her health and that, wow, I didn't lose as many pounds, but I absolutely am getting healthier and losing that body fat.
Oh, that's
Mhm.
awesome. So it sounds like you said that thing is free if someone wanted to come in or set up a
So it's
consultation
yeah.
with
So
you.
the body composition reading is $30.
Okay.
At Wise Weight Management, and I usually will do like specials around the new year for the reading, but you don't have to be a patient at Wise Weight Management. And for the $30, you also get an interpretation from me, with that will help them understand their goals. So with the program that I have with the grant funding for patients that are lower income that do have obesity, they can use the scale for
Mm.
free. So when I give them medical advice, I did get some funding where they're able to use it for free.
Well, it sounds like you guys need to get to her clinic and step on this scale because we really want to change Saginaw County. These rates are
Yes.
too high, and you're doing the piece of the work. We got other people in the community that's also doing it, but I just want to say thank you so much for sharing your story. Again, let them know how they can follow you and come see you as a patient.
Okay. So thank you again for having me. It's
Okay.
such a great conversation to have. So if you go to wiseweightmd.com, you can also search Wise Weight Management on Instagram and Facebook, as well as YouTube. I also will put videos up on YouTube. And so at our office, Wise Weight Management, I share office space with my husband, Dr. Christopher Allen. He's part of Quality Sleep and Neurology. And you can also look us up on Google Maps.
Thank you so much.
Thank you.
Thank you.